Hi, my name is Whitney-Jocelyn Kouaho. I'm a PhD student at the University of California, Irvine. I wrote this paper in collaboration with Dr. Daniel Epstein. So using rapid reviews, we wrote this paper, which is an argument piece. The objective of our study is that we wanted to understand how socioeconomic class shows up in wearables intervention studies, particularly in the design of them. And we also wanted to identify how class cultures are embedded in the design of wearables technology at large. So the contemporary personal informatics space, it reaches back to the mid to late 2000s. Researchers were interested in datification and quantifying the body. And so a lot of the field is interested in creating new ways to track personal data. So exercise, heart rate, emotions, food intake. And also that the space is interested in understanding how to immerse tracking devices into the current technological device ecosystem. We were enticed to evaluate socioeconomic status because we're seeing an increased interest in wearables, both in the commercial space and the medical space. And so as these become more entrenched in the ecosystem, how and what culture themes are being made objective? How is socioeconomic status embedded in both overtly and covertly in our understanding of device use, and how does sociocultural background of participants, how does this intermingle with their experiences? So because no one comes into a device neutrally. The human computer interaction is not a neutral being. It brings into, or we bring into it, our backgrounds, our subjective thoughts and feelings, and our own histories. And so we wanted to investigate how these dimensions are accounted for in our design considerations and also in creating research spaces. Our goal is not to prescribe a basis of normalcy for the field, but our goal rather is to comment on trends and pockets where our research practices should take heed of socioeconomic status as a crucial contention for how one can participate in our studies and how one can use our devices. So there are three main contentions that we will discuss in today's presentation. The first is that there should be a more focused entanglement with socioeconomic class as a framework for understanding research design outcomes. So particularly what this means is that there is, we find that there's an objectivity to the analysis and findings of papers. More specifically, we see a potential entrenchment of ideologies stemming from centralizing insights without identifying how the person's subjective experiences and backgrounds and identity impacts and colors how they come to experience the study of the device. So we think it's important to entangle with how these realities affect one's participation in the study and the data that we've collected from their insights. Because without doing so, we incite a missed opportunity for understanding the way socioeconomic cultures and politics color the way that we as researchers interpret the data, and also how our participants come to the data that we in turn collect. Additionally, we also find that it's important for us to include the socioeconomic data of our participants in our methods sections. This kind of information is critical for contextualizing the voices which inspire our design considerations. The second contention is that time-based requirements, which are central to wearable studies, can be population limiting. So there are a lot of unique adherence components to intervention studies. So that can be device wear time, so how long one has to wear a device while in the study, physical activity requirements, what kind of physical activity one must do, study length, and other more hidden work. All these things require extensive effort on the part of the participant. And so a large part of our intervention studies are constructed on the basis of time. However, time affordances or the usage of time has a direct correlation with SES, socioeconomic status. It also has a correlation to physical activity and health outcomes. Those of a lower socioeconomic status are most likely to be affected by just-in-time scheduling and other work and family-related instability. This has been noted as one of the reasons for difficulty with retention with such populations in research spaces much further than personal informatics. Therefore, working class populations who have less discretionary time and who are more susceptible to time-based disruptions could be less likely to participate in our research studies. Or they may not adhere to all the requirements if they are able to participate. And so there are two critical pieces of this reality. We think the first is that our studies should be designed in a way which allow for flexibility, and which do not work under the assumption that one's time is flexible and malleable, as it can be, as one's access to these affordances differ by social status and employment, et cetera, et cetera. We also found that some researchers, as part of their study design, choose not to include any data that did not fit within the adherence requirements. So, for example, that could be wearing the device 12 hours a day. But we advocate for understanding the data outside of this adherence, because there are interesting insights that can be gained from non-adherence. Why are people not using the device in the ways prescribed by the study? In what ways are they using the device? Why? What can we understand on a design level? And the third critical contention is that physical activity types available on devices and in which are focused on in our studies are indicative of middle and higher socioeconomic class cultures. To be specific, walking is overemphasized in the work. It censors the needs of sedentary workers and not those who work in more physically demanding circumstances. In particular, how labor shows up on the body differs by occupation, and one's occupational needs and also one's socioeconomic status. From work outside of personal informatics, it's been found that those who work manual labor jobs or others of the like are more likely to wear their labor on their bodies, which in turn impacts or could impact how they relate to physical activity outside of that context. So we find that the emphasis on leisure-based activities such as walking or golfing, etc., both reduces the value individuals with low SES background can derive from wearables, as well as it underestimates the level of activity of people who do manual labor. There is a subset of personal informatics intervention studies which are specifically centered in the workplace. However, from the workplace studies we evaluated, none of them were done in a manual labor context. This is a hole in our understanding of work and the physical exertion of the body. It also limits the context of physical activity to one that only a specific subset of the United States can relate, and the general global South. And so by way of this framing, we come to understand physical activity as a leisure activity, or we embed it into wellness culture. So in conclusion, as wearables devices are being investigated for use in medical and other health-related contexts, there's a glaring risk of creating devices which further the healthcare divide and generate inequalities. And so we are creating devices that center dominant populations. However, we live in a nation and world which is largely working class. We are not serving the needs of the majority because we're censoring the needs of the few. Thank you so much for listening. You can find the full paper at this QR code. We also would like to give a special thanks to Paul Durish, on Anne-Marie Piper, and all of the wonderful people we were able to talk to at WISH 2023.